Do you want to entertain having your submandibular glands trimmed when you have a facelift? Our culture in our practice is that we inform you of the choices that we're making that may have an impact on how your facelift turns out and all of the pros and cons around it, so you're empowered to participate with us in making those decisions. So let's talk about these glands here, these submandibular glands. There's a couple of glands in your face and neck that produce the saliva, the moisture that keeps your mouth moist, okay? These submandibular glands, with some people, as they get a bit older, they get a little bit bigger, and also they can descend a little bit. Now then, when you're doing the facelift, and you make a little incision here, and you sort of tighten up this area, you can also access those glands. So you really have two options. If your surgeon tells you, well, we've done the physical exam, your glands are a little bit big or they're a bit descended, you have two options. You can, and your surgeon can discuss this with you, you can go and you can trim a certain portion of it, maybe 20-30% of that submandibular gland out. If you do that, then it's true that postoperatively, you're looking at your result 4 or 5 months later, and you might have a little bit of a slicker appearance in your neck, which means you don't see these little kind of bulges here and here, okay? That would be the positive. But what's the negative? Remember, that gland produces some of the moisture in your mouth. And, as you get older, even 10 years after the facelift, immediately after the facelift, 20 years after the facelift, the whole body sort of dries out to a certain degree. And by removing a certain portion of those submandibular glands, you're putting yourself possibly at risk for a little bit of increased issue with dry mouth. And dry mouth is what helps you eat properly, it protects your teeth. There are implications from this. Another risk, there is a nerve called the marginal mandibular nerve. It passes sort of in the neighborhood of these submandibular glands. A well-trained surgeon should be able to access those glands and remove it without causing damage to that nerve, but you deserve to know that you're at slightly elevated risk, not just for dry mouth, but possibly some difficulty, temporary or, heaven forbid, permanent, of motion of your lower lip. That's a discussion that should, take place. The key point I'm making to you today is, when you discuss your facelift with your surgeon, hopefully that surgeon doesn't just make a ton of decisions for you without letting you in on the fact that they're making those decisions. What we want to do is discuss with you key decisions that you're making. Okay, well, we're not going to trim the submandibular glands, or okay, some other detail about your surgery. We discuss those things with you. We tell you the pros and the cons, and we empower you to participate in that decision making. We recognize some patients, they have their own culture they bring to this. Some patients may be like, listen, you're the surgeon, do what you feel is in your best opinion for me, and let's just go ahead and get the result. We respect that. Other patients kind of want to know a little bit more. Well, why did you decide this? Why did you decide that? We want to strike the right balance with you. We want an informed patient because we always feel that an informed patient is ultimately a happier patient who gets a better result, okay? So that's a kind of a cultural explanation around a specific anatomic point. I hope you found that useful, and please stay tuned for more information about facelift surgery.